Welcome to Fearless Females, where ambition meets resilience. Meet your guide, Lorie Jones, owner of Fearless Financial Advisors. Join her and remarkable women executives as they uncover the triumphs and transformative moments shaping extraordinary careers. Ready to be fearless? Let the journey begin.
Good morning, Fearless Females. Thank you so much for joining us again. I'm hopeful that by this time my website is up there, and I'd like to thank my sponsor, Fearless Financial Advisors. So hopefully you can go on over and check that out. So I'm really excited about our guest today. I spoke with Sarah, and she is a neurosurgeon. And the thing that I enjoyed most about our discussion is just what a good mom she is. You know, when I asked her what she was most proud of, she said her son. And I think that that's so important to realize that she has a really big job. And we all do. We all have really big jobs. But the thing that she is the most proud of is her family. And I think that she tries and spends time with him. She tries and helps him to grow. She gives him a really good example of very successful mom. And I think that the thing that struck me the most about our interview is just how much time and effort she put into that relationship. And still, she was an excellent neurosurgeon. So I think that the message I got out of this is you can do both. It's hard. It's gruelingly hard. And she said there were times that she didn't even know how she made it, but she did it. And as women, we're so resilient and tough and harder than we think. And I think that this really great example of just a successful story, a successful physician, a successful mom, a successful wife. And I'm so excited for you to hear Sarah's story. Let's get started. Good morning, Fearless Females. So we are here today with Sarah Menacho. She is an associate professor of neurosurgery. And thank you so much for doing this for us, Sarah. I have been really interested in catching up with you and hearing what you do and hearing all about your story. So thank you for making the time.
Of course. Yeah. Thanks for being flexible. I know we've gone through multiple iterations to get here. So,
you know, sometimes it takes a while. When you're a fearless female, you're out there fighting the fight every day. It just takes a little while.
True story.
So my very first question is I'm a reader. I love reading anything and everything. Do you have a favorite book?
Yeah, I was laughing when I was looking at this question because I have a 5-year-old. And so the books that I read are kind of on that 5-year-old kindergarten level.
Uh-huh.
And so admittedly, the last book that I read with him was The Giving Tree.
Oh,
I don't know if you're familiar with that.
I love that one.
And, I love that book and my son loves that book. And I actually think it's a great message, on sort of, do we take, and not give and what happens. So I don't know if you're going to put it on your list, but that is literally the last book I read. So
I love it. I actually do love The Giving Tree. And I think on the other side of it, it kind of tells us a little bit about giving until you're totally given out. And you have to watch that side of things too, right?
You do, especially as a parent, this unconditional love, like I sort of tend to be like, okay, we can do that. But you also want to raise someone that understands what it's like to be told no, what it's like to lose in certain situations. So I think both sides of the message in that book are very important.
Yeah, valuable. I do. I love that one. And Shel Silverstein, I grew up on him. And so like the end of Where the Sidewalk Ends, that's always been
another good one. Yeah. Yeah. I need to read that one to him.
Yeah. Yeah. So tell me a little bit about yourself. Tell me about your journey, how you started, how you got where you're at and kind of where you're at, what you're doing today.
Sure. Yeah. I think the journey into medicine probably started early. My mom was a psychiatrist, now retired. And then in college, I went to college in Chicago and I did all of my, kind of pre-med courses. But by the time I graduated, I still wasn't quite sure, and I didn't want to just jump in. Medical school is expensive more now than back then. And so after college, I spent 2 years in the Peace Corps in rural West Africa, a country called Burkina Faso. And I worked out at a rural health clinic, no running water, no electricity. We had vaccines that we kept cold by solar panels, and we did prenatal care, basic wound care, obviously vaccinations. And that experience is really where I was like, okay, I really want to be in medicine. So came back, went to medical school, and sort of fell into neurosurgery by accident. We had some elective time during my third year of med school, and I chose neurosurgery because I was kind of like, oh, that might be cool. Very sort of
Oh, yeah.
very vapid reason for picking this elective. Walked in and saw an emergency case and was just instantly hooked. And I was actually behind the eight ball at that point in terms of getting like letters of recommendation for neurosurgery and doing some other things. So played catch up a little bit, but and I've never once looked back. But I definitely am not one of those people that has wanted to be a neurosurgeon since I was 12 years old or something like that. I really fell into it by accident, but have never once regretted it.
So did you know you wanted to be a doctor young, or you just were kind of targeting the medical profession in general?
Yeah, it was definitely something I was interested in from my mom. And then in college, again, I took the required courses, but sort of the typical pathway is to be like a pre-med slash, biology major or chemistry major or something like that.
Mhm.
I actually was a religion major in
Fun.
college, which was also pretty cool. And so, I was a little bit all over the place in terms of like career, thinking about what I wanted to do with my career. But really, it was that time in the Peace Corps that solidified it. So,
And what made you decide at that point? Was it just seeing the need, or did you you just loved the blood and guts? I don't love blood and guts.
no, a little bit of both. It was sort of the feeling that I got from being able to do something for another person, even in that scenario, very limited resources. And here I am now at a large academic medical center where I have every resource available to me 24/7. But it was seeing what these people were doing with such limited resources, which was incredible. And I was like, hey, I want to develop this skill set, and be able to do this as well, on a much bigger level. And it's actually something on my mind to go back at some point. There's lots of different organizations that travel around and partner with local physicians and exchange ideas and things like that. So once my son gets a little older, I think that's something I would love to do.
Yeah, that's really neat. I love that. So, is there a place or a time during your journey where you made an investment in yourself that you're like, "Oh my goodness, I am so glad I did that thing. If I didn't, I definitely wouldn't be where I'm at today."
Yeah, I would say a more kind of recent investment I've made in myself was that I actually went back to school and got my MBA and just got that in 2024, just a few months ago. And I did that because it's really important these days to understand the business side of medicine. Things change with insurance and reimbursements, and patients are confused, providers are confused. And so I went back and got my MBA just purely so I could educate myself on kind of the more administrative side of medicine.
Yeah.
And that's been very valuable. I can read like a budget sheet now, and I'm now in a role of vice chair of our department. And so, I think it's definitely more recent, but it's something that's really gonna, I feel, set me up moving forward. I mean, the patient care will be better. It's unfortunate that patients come in with a brain tumor or whatever and have to worry about the bill that they're gonna get. That should be the last thing on their mind with a life-changing diagnosis. So just being able to help with that aspect of it and bring them some peace of mind has been really valuable.
I love that you mentioned peace of mind. It's like my motto. It's like
Yeah.
financial peace of mind. And it does
Yeah.
really kind of translate through all sorts of industries. But when you're worried about your insurance, you have a really hard time, even surgery and recovery, because you just don't have the bandwidth to take care of all of those those things that are competing for your attention, right?
Yeah. And often, like a new diagnosis of a brain tumor can come out of the blue. It's not something that you can plan for. And the patient might be, the primary income earner for the family. So they have a lot of financial worry. And it's really the last thing that they should be stressing about, when they're about to undergo major brain surgery, be in the intensive care unit, things like
Yeah.
that. So being able to help them through that aspect of it as well is very valuable.
So, Sarah, you just told me that you have a 5-year-old son.
Son.
Is that
Yeah.
right?
Yep.
And you just finished your MBA. How in the heck did you do that? And still, what did you not sleep? What did you cut out?
Yeah, I actually learned I've always been somewhat of a morning person, but now I'm like an extra morning person. So what I would do is I would get up at, 5 a.m. and do my classwork before anyone in the house was awake,
Mhm.
and then I would start the day, when my son woke up or had to go into work or something like that. So, and if I didn't do that, you're right, then it would be, I feel like I already spend more time than I want to away from my son, because
Mhm.
neurosurgery can be unpredictable, right? When you're on call, who knows what could happen. It's definitely a specialty where you make and break plans, So
Mhm.
that is how I did it. Definitely challenging, though. There was an in-person class requirement every other Friday, Saturday. So, I would be in class and I'd step out, take a phone call regarding patient care, come back into class, or I'd run over here on my lunch hour and round and come back. But you basically have to use every minute, every minute efficiently.
Uh-huh.
Otherwise, it doesn't work. So
It sounds like a lot. How long did it take? Was it a 2-year program or?
it was 20 months. And it was a combination of the in-person component that I mentioned, and then there was some virtual. There was a virtual component as well.
Oh, that's a lot of work. That's a really big time commitment to get that. So I'm glad that that was a good investment. That.
Absolutely, yeah. And the ultimate goal is that hopefully, as I get older, obviously I want to keep practicing as long as I'm capable. But, as I get older and I maybe phase out of taking as much call to use that MBA to get into these administrative roles,
Mhm.
so keep
And
myself
then help
busy.
out on that side.
Yeah, exactly. Still stay active, still stay involved, but maybe a little bit more predictability of the schedule, than, trauma call. So
Yeah. Yeah, I can see that would be difficult. Did you get any really bad advice? Did someone just give you some, what's the worst advice you've gotten? And did you take it? Did you not take it? What'd you learn?
yeah, I've gotten all sorts of ridiculous advice over the years. I'm a woman in a male dominated specialty. So, people are always like, oh, you'll never get a husband. You'll never have kids. You know what I mean? Just ridiculous. But I have to say, the piece of advice that I hate the most, or I shouldn't say hate, that I dislike the most is when somebody says to me, keep doing what you're doing. Because what does that even mean? And, I'll ask for feedback, over the years, all through this journey, student to intern to resident, even now. And when somebody says to me, keep doing what you're doing, I don't know how to interpret that. So, does that mean like I'm doing something wrong, but you just don't have the time to tell me? Or am I doing so great that I don't need any, feedback? I doubt that. So if there's one piece of advice that I can't stand, it's when somebody says that to me.
I guess that's true. I never really thought of that before, but that's like a non-answer, isn't it?
It's a
You're asking.
complete
Huh.
non-answer, and I don't know how to interpret it. So if somebody says that to me, I will literally be like, what does that mean? And I'll push for more details because I mean, I'd like to think that I'm someone that has insight, but maybe I'm doing something wrong and I don't know it. So when you tell me to keep doing what I'm doing, I could be doing something better, but you're not giving me a pathway to that.
Mhm.
So, but yeah, all the ridiculous things that people have said, over the years. I mean, if I had $1 for everyone said that, I'll never get married and have kids because going into neurosurgery, I mean, I could retire now, but you just brush that off. People, I'm not sure why people project that,
Yeah.
honestly.
Yeah. It sounds like I'm not a neurosurgeon, but it sounds like a really hard discipline with a lot of chaos, but there's a lot of places in the world where you have a really hard discipline with a lot of chaos.
Absolutely. No, absolutely. So I think it maybe bothered me earlier on in this journey. You could make it like death by 1,000 cuts, you know what I mean? But
Yeah.
I really have just brushed it off. And even now it continues, people are like, oh, I bet you don't see your kid, or like, oh man, what does your husband think about you being a neurosurgeon? And then I'm like, well, actually, I make the decision, on my career, not my husband, but
I didn't
since
ask,
very
actually.
supportive, so I mean, if I let every one of those comments get me down, I would never be able to get out of bed in the morning.
Mhm.
So really just at this point, I just in one ear and out the other.
Well, and I was talking to someone in the medical profession not too long ago, and she said that the male to female ratio is about 50%, but neurosurgery, what's the ratio?
It's still pretty male dominated. I think it's 80+% male with the remainder female. That's better than when I started. And there are some other surgical specialties. I believe general surgery is very close to 50-50 now. So we're making strides for sure. But yeah, when it comes to neurosurgery, you do kind of still think of a traditional male specialty.
Yeah. Did that ever deter you or make you work harder to get, I mean, did you second guess it even when you started and be like, well, there are not a lot of women here. Maybe I should try something else? Like,
Yeah, I liked it enough that I never second guessed it. There were certainly times where I was down and discouraged, particularly sort of the junior resident years where, you're buried under paperwork, but you're not yet kind of getting in the operating room doing, the surgeries and the cool stuff that made you choose this specialty. So I had some down moments with that, but I was also very fortunate. I had great co-residents, again, mostly male, some women, who were very, very supportive. And you're spending just ridiculous amounts of time with these people. So they really become like your family. I was single at the time. And so I relied on those guys and women to get me through it. Certainly, I've heard horror stories from female colleagues around the country who had bad experiences with co-residents. And I think if I had that, I don't know that I would have made it through the 7 years because like I said, you're sometimes eating 3 meals a day with these people, so if you don't get along with them, I can imagine it's miserable.
well, I love that you provide an example for other girls who are looking around and saying, well, what should I be? Well, she's a neurosurgeon. Maybe I could be a neurosurgeon.
Yeah, I hope that I can be in that mentor role. I get a ton of emails from female medical students, female undergrads who inquire about the specialty. And I really try to go out of my way to make time to, if they want to come and chat in person, great, or we'll jump on a Zoom or a Teams and chat about it. And certainly of the people that I chat with, probably less than half decide to pursue neurosurgery. But you know what? That's okay because it is a demanding specialty. So don't go into it if it's not something that you love, whether you're a male or a female, So, but I get these interesting emails. Oh, Dr. Menacho, what was it like to be a neurosurgeon and be breastfeeding? You know what I mean? And how
Yeah.
did you pump? So I'll get those. And then I'll get emails from certainly male undergrads who are like, oh, I heard you let students shadow. Can I come watch a case? I'm interested in neurosurgery. And I'm like, yeah, come on
Mhm.
through. So really runs the gamut of what people ask. But I think that's important when you're going into, such a demanding specialty. And there's other demanding specialties too, of course, that make sure you turn over every stone before you start on such a long journey.
Yeah, that's really good advice. You have to want it because it's going to take everything from
It
what you
is. And it sounds cliche, but there will be sacrifice. You'll probably miss some family events. You're going to watch your friends in other specialties who have shorter residencies graduate, buy houses, get married, have kids. Not that you can't do that as a resident too, but you're going to sort of watch them have these life events. And yeah, you're going to have those life events too, but they might just be a little bit farther down the road. And you have to realize that. And you have to really want this. And to me, I wouldn't want to do anything else. But I want students, whether they're men or women, to just really understand that before starting on this journey. Certainly you can start residency and then you can switch, and you're not bound to anything. But as much as possible, you want to make the right decision up front. It's just
Yeah,
easier.
that makes sense. So, do you have a situation during your professional journey that you look back on and you're like, oh my goodness, I wish I had known at that point what I know now, because I would have handled that so much differently.
Yeah, I think I wish that I had had maybe more female mentors, because I don't even know if I would call this a regret, but I do think that maybe had I had that, I have a beautiful, healthy 5-year-old son, but I might have had maybe one or two more children. I think if we had started trying for a family sooner, and I'm an older mom, I had my son when I was 38. And I sort of had this mindset, can't get pregnant as a resident, can't get pregnant as a fellow, it'll overburden my colleagues. I wish someone had sat me down and been like, the time to start a family is when you and your family are ready and not what anyone else thinks. And that's the advice I give to our female residents now. As recent as last week, I was talking to someone about this. So again, it's not really a regret, but maybe if I had started trying for a family at 30 or 32 instead of, 37, both my husband and I are like, oh yeah, we probably would have had a couple more. But then we count our blessings that we have a healthy child. And so again, it's not more of a regret. It's just more something maybe I could have done differently.
Yeah, like you might. And who's to say that you wouldn't end up at exactly the same place making exactly the same decisions that you did
Absolutely.
make. But that is interesting, that if you had maybe had an example of someone in your field that had navigated that space successfully, it might have given you a different viewpoint on it.
Yeah, I think it would have been nice to just have someone say it's okay to do this, because at the end of the day, the advice I give now is when people are like, what's the right time? And I'm like, the right time is when you're ready and not anyone else. And maybe if I had had that, things would have been a little bit differently. Would have turned out a little bit differently. But again, I'm really happy. One of the anesthesiologists a few months ago said, you're the happiest neurosurgeon I know. And I said to him, what do I have to be unhappy about? I have a great job, pays well.
Yeah.
My husband loves me. I have a healthy son. I mean, really, what, I have some times where I might have a bad day, but I mean, why wouldn't I be happy? So
I love that. My goal for the year is positivity. So I love that idea of just like bloom where you're planted, or just be happy with who you are and what you have. Because
absolutely. Yeah. I mean, you can't sit around wishing your life away.
Well, and you worked so hard to get here. It makes it nice that in the end, you can look back, or you're not at the end, you're not anywhere close to the end. But, after all that effort and work, you kind of look back and say, I'm glad I did that. And I'm happy now. And, there were hard times and easy times. And
yeah, absolutely. And I hope that when prospective students who are interested in neurosurgery see that it dispels some of the myths that, we're miserable, angry people who live at the hospital and the divorce rate's high and we don't see our families. I think there's a lot of negative stereotypes that swirl around out there. So, I mean, in no profession are you going to be happy all the time, but I hope that when people meet with me, they see that I'm doing what I love and I'm happy doing it.
So if you could go back, Sarah, and talk to yourself at, say, age 20, do you have any advice for her?
Yeah, I thought about this question too. And I was like, I'd figure out how to stay age 20 so that my joints don't ache when I get out of bed these days, but in the absence of time travel, I think I would probably tell myself to just not worry as much about what people think, which sounds a little cliche, but I distinctly remember back then that it was really important to me to hear the opinions of others. And I would get caught up in silly little dramas with these, not even friends, or like acquaintance circles. And of course, you're in college and you're experimenting with like a lot of things for the first time, being away from home and things like that. But I honestly just wish that I would have just not worried so much about maybe things like fitting in and just enjoyed the experience. Because when I look back on it, I'm like, oh man, I wish I go back to those college years, when you thought you had responsibility, but you really didn't. Yeah,
I know. Like, what are you responsible for? Like nothing, right?
Yeah, I mean, homework and things like that. But you're not married. There's no kids. You're, living away from home with a bunch of people your age. I mean, I'd love to do that now. So that's probably what I would tell myself.
Did anything scare you when you started your career? And does it still scare you, or did you learn how to work with it?
Yeah, I think when I first started as an attending, I think early on, I had those kind of doubts a little bit creeping in of, can I really do this? Like, I'm making the decisions now. Everything that happens with this patient comes back on me. You know what I mean? Like, can I really cut it? Do I have the skills? But then probably 6 months to a year in, and early on, the advice that you get is to not jump into anything too complex in the OR, just fresh out of fellowship, just get a lot of basic cases under your belt. So I did that. And I think that was great advice. And then did a few complex cases. And then you start to realize, okay, like I can do this, I put in the work. I did my fellowship, and now I'm in charge, but like the patients are doing well. And every surgeon is going to have complications. And any surgeon that tells you that they haven't is either lying or hasn't done that many cases, But so I'm certainly not going to sit here and say that, I haven't had complications. But I think, definitely those nerves the first few months of like, I'm hired here at this big academic center. Can I really cut it? And those are mostly gone at this point. So
it's just like repetition, just doing the thing until you're like, oh yeah, I can do this.
Yeah, exactly. Just thousands of hours practicing. And even as an attending now, I'm technically not in training, but I mean, I've learned so much, and there are cases that I've learned how to do since I've been back here from my colleagues that I'm doing now that I hadn't done for whatever reason as a resident or a fellow. So really, even though I'm technically not in training, I'm still learning, and the field has evolved. There's new technologies, minimally invasive stuff that's better for patients. And in the age of the internet and social media, right? Patients are going to know about this. They're going to come in and say, well, so-and-so does it minimally invasive. Can you do that? And you want to be able to say, oh, I can. And now I can. Or they'll ask about, what's that laser thing for brain tumors, and I'll be like, yep, we do that. Let me walk you through it. So you have to be evolving with the times. Otherwise, I think you won't really advance your career.
Yeah. And that does have to be like, that's a scary thing to get out of school and get out of your residency and have someone's brain in your hands.
It is. Yeah. And, I tell patients, whether it's supposedly quote unquote a straightforward small case or a complex case that's going to take all day, I say every brain surgery is major brain surgery, no matter how big or small it is. Because, at the end of the day, these people are entrusting their brain to me in my hands. So I never take any case lightly, even if it's a common one that I've done 500 times. To that patient, that's their first time having a brain surgery. And, they're trusting me with, in my opinion, the most precious organ in the body, so that's important not to take that for granted.
Yeah, I see that. It would be a great responsibility. It would be a lot of responsibility, but I think that and also you treat that with respect.
You absolutely have to. And myself and my colleagues instill that in the residents. Just because this is a quote unquote straightforward procedure doesn't mean that we're going to blare loud music and talk about our weekend plans. It's the same focus as if we were doing a complex brain tumor that we know is going to take 10 hours. So you have to have that respect, as you mentioned.
So did you face any unique challenges because you were a woman?
I mean, definitely as we sort of talked about earlier, there was certainly the passive aggressive comments, and frankly, I still get those today. You walk into someone's room and they think you're the nurse or the person coming to take their dinner order. And again, you got to let that roll off. It was challenging when I came back from maternity leave. And by the way, my chairman in this department were incredible in terms of the maternity leave. And we had no policy because they had never had a woman of childbearing years on faculty. So we created our own policy and it was great. But it was certainly challenging to come back. I had a 3-month-old at home. I was breastfeeding and pumping. And I missed him. I wanted to be with him. And I was taking call again. And again, nobody was really forcing me to. I felt like it was time to go back. And so I think that was very challenging. I'd sort of pump in between cases or, real quick pump before and after. And I might run home from the hospital in between cases to just say goodnight to him. Or even though he was 3 months old, he's not going to remember. I'm like, well, I remember.
I remember. Yeah.
So,
baby snuggles.
Exactly. And also just sometimes to give my husband a break, because we don't have any family in the area, neither one of us. So
Mhm.
a lot of times it was just the two of us, and we certainly had an excellent nanny, but she's got to go home at some point. So
She leaves you alone.
yeah, so that was definitely challenging, but you navigate through it, and we made it through. And even now, as I mentioned, he's 5. And he's funny. I'll say, "Oh, mommy's got to go into work," and he's like, "Does someone have an accident?" Because he'll know
Oh.
I'm on trauma call.
Mhm.
And then, or he'll say, "Oh, does someone have cheese in their brain?" That's his word for like a tumor. He's like, "Do you have to go take out cheese from someone's brain?" And I'm like, "Yeah, buddy, but mommy's got to go, got to go." So he's starting to sort of get it. And he's like, "Okay, mommy, good luck," things like that. So
I love that example. I love that our kids are watching us do these hard and be successful at these really hard careers and do these hard things because I hear a lot of times from women just the mom guilt. I'm not spending enough time. I'm not, blah blah blah. But I don't think that we recognize probably the other half of that, which is our kids are getting a really good example of a very successful career, a successful professional, and they take that. There's been studies that show that they take that into their lives and
yeah,
mimic those things. So I think
yeah.
you're teaching them more than we know.
I certainly hope so. Yeah, and I do think he understands that. If I'm leaving, if we made plans to go to the zoo or whatever, and I have to go to the hospital instead, he knows that I'm not just going to like hang out with my friends or he's like, "Oh, you got to go to help
Yeah.
someone." And so it's amazing what they can pick up on even when they're so young.
Yeah,
So
even at young, I love that. I love that he gets that example and that he knows that mom is going to help and that her skills are needed and that no one else can be there to do that. So I
right.
love
No,
that.
exactly. But the mom guilt is definitely a real thing. I'm sure dad guilt is a real thing. That was certainly challenging to navigate. But again, you just make it work, whether it's getting up earlier or, putting him to bed. And then I do my notes that I have to dictate, or something like that. You find a way to make it work.
Maybe AI will make it easier on all of us, right?
Yeah, there are actually AI generated note templates now, which cuts down the work. But, unfortunately, you still got to go on and, fill in the blanks. And it's debatably faster. So,
Well, we'll keep working on it.
yeah, exactly.
That
Exactly.
next generation of tech, they can fix this problem for us, right?
Well, my son, even when he was, 2 or 3, it's amazing how quickly they learn to like swipe on your phone. They figure that out. And I'm like, how did you know how to do that? So I might just be ingrained at this point.
Yeah.
So
I know it was really funny. My daughter was maybe 3 years old, and I realized that we were not the same. Like, we didn't even grow up in the same world because she picked up the phone and it had a screen on it and she started like bashing at the screen.
yeah,
And like me, like there are buttons there. That's what you do. You push the buttons, right? But
yeah.
my daughter was the era that like she didn't even know there were buttons there. It was just the screen
Right.
she was trying to push.
Yeah. No, it's amazing what they pick up on, watching you. And then all of a sudden, let him play with my phone and he can like get to the keypad. And we taught him our phone numbers just in case and he can type it in. And I'm just like, holy cow. So
Yeah. So, what, Sarah, is the thing that you are the most proud of?
yeah, I thought about this question quite a bit. Honestly, probably being a mom,
Mhm.
and I thought about being like, I mean, being a brain surgeon, but
Mhm.
it's like, no, it's like being a mom. I love it. We talked about some things, where I have to make and break plans from time to time, but watching him grow and develop and teaching him how to like ride a bike, or every once in a while I'll take him in to like round with me and he just kind of hangs out on his iPad, while I'm talking to patients. Like I love that, So I'm obviously proud of the hard work that got me to where I am now, but I mean, I wouldn't trade being a mom for anything.
Yeah. It's good that all those naysayers that were saying you'd never get married and you never have kids were wrong.
Yeah. Yeah. And then the ones that say that I'll never see him and then I'm going to get divorced, and I'm like, well, so far, so good,
So they
So
keep telling you all those fun.
they don't
Not,
stop the criticism. They just sort of change it, So, but what can you do? Like I said, in one ear and out the other. The people that know me and care about us don't say those things.
Mm-hmm.
And those are the opinions that matter. So I can't be bothered by white noise.
Yeah, I like that. I like the idea to kind of tune out those messages that it's not like you're tuning out messages that are filling you up or making you better or helping you change in constructive ways. You're just tuning out the white noise, the stuff that doesn't make a difference.
No, absolutely. And it took a while to learn how to do that. Especially early on, someone would say, oh yeah, you won't ever go home. You'll never find a partner. And a couple times I'm like, are they right? You know what I mean? But again, the people that care about you, that know you are like, that's ridiculous. And don't listen to whoever is saying that. And it certainly wasn't just men, certainly women were saying it too.
Mm-hmm.
And so after a while, you start to realize that what they're saying isn't true. And then at that point, it just becomes what the white noise.
So any advice for a young lady who's just starting down this path that you're already successful at? What would you tell her?
Yeah, I feel like I have these conversations pretty frequently and sort of touched on it a little bit. I would just say to try to expose yourself to the specialty as much as possible. Come in, shadow some cases, follow us in clinic, on rounds, and just as much as possible, try to make sure that this is what you want to do for the reasons that we mentioned, the time commitment, the length of the residency, the challenges. And I tell people, I love it, but you are going to work so hard and you're going to be so tired, and like I said, your friends that did other specialties are going to be done and making money. So just make sure that it's what you want to do. And again, you certainly can start a residency and switch, but that's extra stress, right?
Mm-hmm.
Like in order to make the best decision, informed decision that you can up front, just expose yourself as much as possible. Talk to women, talk to men, talk to your family, and just see as much as you can.
That's interesting. I was reading something about a job posting for like they were going on some sort of boat adventure or something like that. And the job posting was something like you have to like staying up for, 24 hours at a stretch, being freezing cold, not eating for 3 days and stuff like that.
Yeah.
So it sounds like you're like telling them all the things that could, like you have to be prepared for those.
Yeah. You don't just want to say, oh, I think the surgeries that you do are cool because yes, they are, but you have to understand the journey that it's going to take to get you there. So yeah, just exposure as much as possible. And I think the students are doing that. Like I said, they email me, they come into the OR, we talk, and a lot of times a month or two later, I'll get an email. Oh, thank you so much. But I decided to go into, anesthesia or a different surgical specialty or a non-surgical specialty like neurology. And I'm like, great, best of luck. That's why you come in and you shadow me so you can decide whether you want to do it or whether you don't want to do it. But they're almost apologetic. And I'm like, no, like if I helped you determine the right career for you, then great. Oh, I don't care what it is.
Yeah. I like that. Well, Sarah, thank you so much for spending some time with me today, especially I know how busy you are, and I really appreciate you spending some time just chatting and sharing your story. If I have listeners that are interested in getting in touch with you, how do they do that?
Yeah, email is probably the best. It's just sarah.menacho@hsc.utah.edu. And I try to check that every day at least. Sometimes I'm not the best, but I will get back to you and we can chat or set up a time. If you want to shadow, there's a few basic paperwork things I have to do, but always happy to have people, come watch.
Well, thank you. Thank you for sharing your time and thank you for sharing your story. I appreciate it.
Thanks for having me. It was fun.